Liz is a Cuban American cisgender woman, pronouns she and her, who self referred to counseling services for the first time after receiving results of elevated blood pressure, irregular liver function, and becoming non-compliant with further medical visits from her PCP, or her primary care physician. Liz disclosed that she took on additional duties at her job at a talent agency, which has become noticeable to her immediate family, who states they don't see her anymore and expect her to do more for the family than just send her nieces and nephews money. In addition, these work stressors and the lack of life and work balance has resulted in the breakup of her last relationship with a woman. At this point in treatment, Liz is in the contemplation stage but is amenable to continuing individual therapy services to manage her work-life balance and work addiction symptoms. Work addiction, an overview. Workaholism is largely seen as a positive problem to have. It's also not in the DSM, uh, the current edition, which is the fifth. So, heavy work investment due to workaholic behaviors, taking on more tasks than being paid to do, feeling more fulfilled when doing work instead of social activities, or the inability to talk about other topics besides work, according to Andreasen and others in 2018. And secondary traumatic stress, or STS, from workaholism. So, workaholism can result in burnout, which impacts personal relationships. And Liz disclosed not seeing her family as often as they would like to see her, and she is not currently dating, and she disclosed that her last relationship broke up, and she said that her partner did not understand her work. Diagnosis of work addiction. So this one was admittedly tricky, but I did find the Z codes. So Z56.6, which is other physical and mental strain related to work, according to ICD-10 data in 2022. Liz does not appear to be distressed about her symptoms, and it is important to note that, considering that when she initially presented to treatment, she tells about how her symptoms have really impacted the people around her, namely her family of origin and a past relationship. And she doesn't report depression or anxiety. She doesn't engage in self-harm that we know about, or substance use of any kind. And further, the level of care that is appropriate for Liz, she is a good candidate for outpatient care, because she does not present immediate life-threatening symptoms, and she is able to participate in individual therapy and, if necessary, medication management should she choose to use it. Uh, and it'll also allow her to go back home and to also return to work when it's time for her to work. So there were ones that I ruled out. So the generalized anxiety disorder, which was the main one that I was considering at first when I started this project. Obsessive compulsive disorder, major depressive disorder, and bipolar 1 disorder. I did put bipolar 1 as a possible just because some of the symptoms that Liz is exhibiting really mimics a manic episode, but it's not, she doesn't meet all of the criteria for one. And then the generalized anxiety disorder, so like the lack of sleep, she's restless, she shows some irritability when talking about like her family, and then like also when she talks about um her past relationship, like how they didn't understand and that's why they're no longer together. And then the sleep disturbances, which also mimics major depressive disorders symptoms as well. All right, so these are some of the ethical concerns. So section A2A, which is the informed consent, to ensure Liz that she knows that she can terminate sessions and she understands the whole therapy process as well as like the referring out. And then also section A2C, developmental and cultural sensitivity. So a big one with this was mostly to use appropriate, clear language for ease of access and understanding for Liz. It is not mentioned that she speaks a different language or a secondary language or other languages, but one thing that is important to note is that this is the first time that she has presented for counseling. And then section A to B, the types of information needed. So I did bring this up a little bit earlier. Uh, she was self-referred after visits with her PCP. So that's how we were able to determine that we were able to know about her lab results, like showing irregular liver functioning and the high cholesterol levels, and that her doctor also wanted to talk to her like about a weight, like controlling diet for weight gain, and she wasn't amenable to that. But in order to do all of these tasks, especially for further treatment planning and care coordination, we do need a release of information. And then section C2A, the boundaries of competence. So this is mostly with the relationship the therapist or counseling professional has with a client like Liz, who presents for work addiction. So consider counseling professionals' competence in working with individuals who have extensive work addiction. Here are some goals for Liz. So I did put them in the SMART format. SMART meaning specific, measurable, attainable, realistic, and time. So the first one being Liz will cease all work-related activities after 5 p.m., checking email, returning and making phone calls, accepting meetings, scheduling, sending emails, completing calendars, and sending reminders. And Liz will stop working after 5 p.m. Monday through Friday, so this is during the week, and without engaging in work on weekends, which is Saturday and Sunday. And this is attainable as a baseline, and this is also realistic as Liz can leave her phone and computer out of reach and turn them off. And then finally for time, Liz will start this on the 5th of December and conclude it on the 9th. So at this point, today is the 7th, and she is almost done with the baseline week. And for the second client goal, Liz will engage in meditation awareness training sessions, or MAT. Liz will complete one MAT session, which is 90 minutes, once per week for 8 weeks. This is attainable as a baseline, considering she can do this after 5 p.m. before sleep. And this is realistic because it can fit into Liz's schedule of activities. She does do really well with schedules. Finally, Liz will start her first session on Wednesday, tonight, 7 December, and conclude on 25 January 2023. Here are some interventions for work addiction and Liz. So these include CBT, or cognitive behavior therapy, which often involves homework assignments, such as journaling or using a workbook, logging or tracking activities in a journal. This helps individuals identify their emotions and triggers with the goal of finding alternative behaviors and teaching appropriate coping skills, according to Penix et al. Or others, 2020. And this will also help provide psychoeducation because, as far as this writer knows, it looks like this is Liz's first time being in counseling and seeking therapy services. She did self-refer, so this would be helpful. It will help identify cognitive distortions, which can then help Liz understand her thinking, emotions, and self-criticism, according to Burns in 2000. And then mindfulness-based stress reduction, or MBSR, she can learn about and accept the contents of her own mind, which has been effective at treating generalized anxiety disorder, or GAD, or feelings of anxiety, according to Shonin and Van Gordon, 2015. Some risk to consider with Liz and work addiction, and also using mindfulness-based interventions, or MBI, and the mindfulness-based stress reduction. So despite these mindfulness-based interventions' roots in Buddhist spirituality, a counseling professional must acknowledge that these interventions may appear religious in nature, and that is something that Liz has not disclosed during initial sessions, so we don't know how her attitude might be towards something that sounds like it'll be religious or spiritual, just because she hasn't really told us any of that. And then is mindfulness and meditation a good approach for Liz? Consider cultural aspects and views towards these by Cuban American and the Hispanic population. So I've included some sources here, additional readings and books, uh, to help Liz further understand the tenets of mindfulness and meditation, And these are all good sources that also come from people of color, as well as from some people that are in the same industry as her. So it would be a little bit more approachable for Liz to continue to use. So the Mindfulness in Plain English collection, which is from Wisdom Publications, I have quoted this in the next couple of slides. And then the Four Sacred Gifts, Indigenous Wisdom for Modern Times, which is written by a Mexican American and Aztec uh, professional. Her name is Dr. Anita Sanchez. And then the other two by Harris and Shapiro, so Meditation for Fidgety Skeptics, and then Good Morning, I Love You. So these ones are written by professionals that are about or very close to the same field that Liz is in, where she works at a talent agency. So Shapiro works as a clinical psychologist, and she's internationally recognized as an expert in mindfulness and self-compassion. And then Harris is the co-anchor of ABC's Nightline and the weekend editions of Good Morning America. And then he's also written some other works like 10% Happier. But this one was a very approachable book to teaching somebody that is new to mindfulness and meditation in layman's terms. So how do we practice mindfulness of mind? Since we know mind only by its contents, we cannot contemplate or focus on just the mind. In a nutshell, the practice consists of cleansing the mind so that the harmful tendencies toward desire, hatred, and ignorance, the same tendencies that cause us to take rebirth, do not have the opportunity to manifest as actions. If they do arise, we make the effort to overcome them. And when they are overcome, we make the effort to replace them with beneficial states of mind. Desire, hatred, delusion, and other poisons are able to pollute the mind because of the harmful tendencies or inclinations we created by our previous actions. Whatever thoughts we cultivate frequently become a habit. For instance, when we are accustomed to angry thoughts, it is easier to entertain angry thoughts in the future. These harmful tendencies hide within the mind until they are activated by contact with external objects and situations. That's why, for example, spending time with angry people can activate our own tendency to anger. However, once the mind is purified, we no longer have to guard our senses against external situations that can simulate deluded thoughts. A person who insults us does not make us angry. A person who craves wine and offers us some does not make us want to get drunk ourselves. As the sutta explains, as rain gets into an ill-thatched house, so craving gets into an untrained mind. As rain does not get into a well-thatched house, so craving does not get into a well-trained mind. Worrying over or dwelling upon harmful actions we have done in the past is a waste of time and energy. Instead, we should put our efforts into cultivating beneficial thoughts to overcome and replace harmful ones. In fact, we must cultivate thoughts of generosity, compassion, loving friendliness, and equanimity again and again in order to weaken and destroy harmful inclinations and create beneficial ones. We do this most effectively by practicing mindfulness meditation. As I have mentioned, our practice consists of two types of meditation, concentration meditation and insight meditation. Concentration meditation suppresses the hindrances and makes the mind calm, peaceful, and luminous. Hindrances are negative tendencies that obstruct our spiritual progress and interfere with our ability to concentrate. Insight meditation, which we have been calling mindfulness, eradicates the hindrances and all other negative tendencies. It helps us to overcome ignorance so that we can be liberated from samsara, or the cycle of repeated births and deaths. Start in the usual way, eyes closed or half closed, relaxing into the posture as you breathe out, straightening up the spine as you breathe in. Setting an intention here to not get too uptight about things to go along with the experiment. Take a few breaths to get settled. Get curious about what's going on with you in this moment. Is there any way in which you aren't totally fine? Maybe there is some rushy anxiousness or a dull heartache or a feeling of stress. Or maybe there is some clear physical discomfort happening. Or maybe there is nothing like this at all. Sometimes we're just idling along in neutral. All of these states are fine. All we need to do here is sit with exactly what's happening inside us, not trying to fix anything. The beginning of compassion is allowing ourselves to feel what we feel, to be this exact person at this exact time. just breathing into our bodies and sitting in this accepting way with ourselves. Now for the self-compassion part. Start by connecting to a simple intention inside yourself to be well. There's nothing necessarily sentimental here. We're talking about the extremely reasonable desire to be healthy and not in pain. A short phrase here can help. May I be well. This is different from noting or using a mantra. It's using a short phrase to highlight your intention. If that language sounds lofty or artificial, use a different one. It's okay or feel better. Choose words that feel natural to you. The key is to connect to your own sensible aspiration for your discomfort to pass. You are not trying to fix a problem or think about all its permutations. Put that all aside. You are going below it to the most simple and uncomplicated intention. Obviously, I'd prefer not to suffer. Who wouldn't? Some people recruit an image to help with this, for example, the image of themselves as a little kid. This can help kick in some nice warm feelings, although warm feelings aren't required. You can imagine yourself as a 4-year-old running around in a park with ice cream smeared all over your face and then you wipe out and start bawling. Oh man, may you be well, little lady or dude or gender non-binary kiddo. Can you connect to the reasonable feeling of wanting that kid or you to be happy, to no longer be in pain? You can use any scenario, real or imagined, that works for you. And of course, you can use an adult version of yourself too, because that kid is still inside you, nested like a Russian doll inside your years of learning and living. May I be well. The practice is returning again and again to the simple intention for you to be well, and then sending that intention to yourself. You can use an image to help with the latter, or, if images are tricky, you can simply focus on the embodied sense of yourself sitting. May I be well. It helps to smile. Notice what feelings come up. All are fine and natural. The specific feelings are secondary to your intention. You may feel loving or calm. If so, great, enjoy. Or you may feel annoyed or self-conscious. Also, no problem. If the latter occurs, have a sense of humor about the backfiring hilarity of this meditative situation and send that sense of humor down and into your black heart. Compassion by another name. There's always a workaround. May I be well. Connect to the reasonableness of the intention behind your words. May I be well. For real. Like everyone else on the planet, you're doing the best you can. May I be well. May all of us be well. Recognizing our shared human condition. There can be something very poignant about this. So that's the main part of it. You're sitting here repeating your phrase, and as you do, you're continually reconnecting to the simple intention for your suffering to ease. Sending this to yourself with maybe an extra visual or feeling. It's okay if it seems awkward at first. You're like an actor rehearsing your lines. It gets easier with time. May I be well. Eventually, your focus will be less on the words and more on the intention behind them, which gets stronger and clearer and more obviously common sense. There's one more thing you can do. If some specific part of your body actually hurts, then imagine sending your caring intention directly into that part, opening the channel, sending in healing vibes. May I be well. You are practicing giving a shit about all parts of yourself, and then feeling what you feel, feeling and fellow feeling. May I be well. May all of us be well. A good way to finish this meditation is to expand the circle of compassion out, to imagine others in your life, others like you, people doing the best they can. Connect to your intention for them to also be well. May you be well. Find a phrase that works for you and silently repeat it if you like, maybe visualizing faces near and far. May you be well. Think of it as a final act of generosity, sending out your intention and your care and the benefits of the practice to others. Maybe there's some gratitude there. May you be well. It's basically the best training program a human being can enroll in ever. It's worth the effort. Finish up by feeling the breath in the body, solid in your posture, supported by the ground, chilling on your stoop like a little Buddha. A final couple of breaths into the chest, feeling that area filled with air and warmth. When you're ready, open your eyes. Yes, you just did that. You are now a beautiful marshmallow of compassion.